Alcohol in excess is one of the most underestimated threats to people with high blood pressure, in part because drinking is so deeply woven into social life, celebrations, and relaxation rituals. Many view it as harmless fun or even beneficial in small amounts, but when consumption tips into regular or heavy use, alcohol becomes a relentless enemy of cardiovascular health. For those already struggling with hypertension, excessive drinking doesn't just nudge blood pressure upward, it accelerates the condition, destabilizes the body's ability to regulate it, and multiplies the risk of life-threatening outcomes like stroke, heart attack, and organ failure. The immediate effects of alcohol on blood pressure are often hidden. Drinking causes blood vessels to constrict and forces the heart to pump harder, raising both systolic and diastolic pressure. At the same time, alcohol interferes with the central nervous system, disrupting the delicate balance of hormones that regulate blood vessel tone and fluid retention. This means that after a night of heavy drinking, blood pressure can remain elevated well into the next day, and repeated binges train the cardiovascular system to live in a state of heightened strain. For someone with hypertension, these spikes aren't trivial. They're surges that can damage artery walls, increase clot formation, and bring the body dangerously close to hypertensive crises. The long-term consequences are even more troubling. Chronic heavy drinking damages the liver, the organ responsible for filtering toxins and maintaining fluid balance in the body. A weakened liver allows fluid retention and hormonal imbalances, both of which worsen blood pressure control. Alcohol also damages the kidneys, which play a central role in filtering sodium and maintaining blood volume. When the kidneys falter under the toxic burden of alcohol, hypertension accelerates dramatically, creating a vicious cycle where high blood pressure damages the kidneys further and failing kidneys make blood pressure even harder to manage. This combination is one of the most destructive pathways leading to chronic kidney disease and eventual organ failure in heavy drinkers. Excess alcohol is also calorie-dense, and those calories are usually empty, meaning they provide no nutrients, but still contribute to weight gain. Alcohol is notorious for encouraging fat accumulation around the abdomen, which is one of the most dangerous forms of obesity for people with hypertension. Abdominal fat produces inflammatory chemicals that stiffen arteries and interfere with hormonal systems that regulate blood pressure. This means that heavy drinkers often face a double burden. Not only does alcohol directly elevate blood pressure, but the weight it encourages makes hypertension even more severe and persistent. Another hidden risk is alcohol's effect on medication. Many people with high blood pressure rely on drugs like beta blockers, ACE inhibitors, or diuretics to keep their condition under control. Alcohol can blunt the effectiveness of these medications or, in some cases, dangerously amplify their side effects. For example, combining alcohol with blood pressure medications can cause dizziness, fainting, or irregular heart rhythms. For someone with hypertension, this interaction is not just inconvenient, it can be deadly if it leads to sudden drops in blood pressure, arrhythmias, or organ strain. Heavy drinking also destabilizes the heart's electrical system, increasing the risk of atrial fibrillation, a condition where the heart beats irregularly and inefficiently. This irregular rhythm not only raises blood pressure but also dramatically increases the risk of stroke due to blood clots forming in the poorly contracting atria. In fact, alcohol-related atrial fibrillation is so common that doctors sometimes refer to it as holiday heart syndrome because episodes frequently appear after periods of binge drinking during festive seasons. For hypertensive patients, adding irregular heart rhythms to already elevated blood pressure is a dangerous combination that multiplies cardiovascular risks. The social normalization of alcohol makes its dangers harder to avoid. People often downplay their intake or convince themselves that moderate drinking offers protective effects, pointing to studies on red wine or occasional low doses. But these potential benefits vanish entirely when drinking becomes frequent or heavy. For individuals with high blood pressure, even socially acceptable levels of excess drinking, like several glasses of wine or multiple beers at night, may be enough to undo the progress made with lifestyle changes or medication. Over time, these habits erode the cardiovascular system quietly but aggressively, leading to outcomes that feel sudden but have been building silently for years. The harsh truth is that excessive alcohol is not just a lifestyle choice, it is a direct accelerant of hypertension, damaging nearly every system the body uses to regulate blood pressure. It raises systolic and diastolic levels acutely, destabilizes hormonal balance, damages the liver and kidneys, undermines medications, encourages weight gain, and weakens the heart. For someone already vulnerable to high blood pressure, this is like stacking logs onto a fire that is already burning out of control. The more one drinks, the harder it becomes for the body to recover, until the system eventually breaks down under the strain. For people with hypertension, excess alcohol is never harmless. It is a slow but powerful toxin that transforms blood pressure from a manageable condition into a dangerous, life-threatening disease. Each heavy night of drinking adds pressure, literally and figuratively, on the heart, arteries, and organs, moving them closer to irreversible damage. The warnings about alcohol are not exaggerated. For hypertensive individuals, reducing or eliminating excess intake is not just advisable, it is vital for survival.